We are going to do a Foley catheter insertion on a female patient. I have checked my order, I've knocked on the patient's door, introduced myself, explained what we are going to do. I'm going to wash my hands and provide for privacy. I will identify my patient. Can you tell me your name and date of birth? Okay, and do you have any allergies, specifically to latex or iodine? All right, I'm going to verify my order. And I have gathered my supplies. I have a Foley catheter kit, clean gloves, and a leg strap for after the insertion. I have already raised the patient's bed, and I'm going to leave this side rail up because I don't need to access the top half of his or her body right now. Okay, I'm explaining everything I do as I do it for my patient. I'm going to pull down your blankets all the way to the foot of the bed. Again, we want these completely out of our way. So off of the feet. If your patient is cold, you can offer them a bath blanket for their top half. I'm going to expose you and open up her legs in a frog-like position. If she was soiled, I would provide perineal care at this time. Everything looks clean, so we can go ahead. I am right-handed, so my table is on the right side. Make sure that you are thinking about your table placement and how you prefer to have everything set up, especially before you open your sterile field. If you have access to hand sanitizer, you can wash your hands when you take your gloves off. If not, it's fine. Putting that off to the side because I don't need it. And I will open my Sterile Catheter Kit. Using my trash bag, or my bag as a trash bag. Opening it up so that it's easy to access. I'll leave it at the foot of the bed. This is trash. Going to open my sterile field away from me. And then each side. Making sure I'm only touching the edge or the shiny bottom part. And just touching the corners. I'm going to turn it so I have some space over here to put my gloves on. Remember, the outside 1 inch of this field is not sterile. Now I will grab my drape. You can touch the shiny side and place that down for your patient. It doesn't have to be in the perfect position because once you have your sterile gloves on, you can adjust it. I have my sterile gloves here. So I'm going to step off to the side so that I can put my gloves on without putting the paper over my sterile field. And go ahead and tent that so it doesn't fall back over. If the paper falls over onto your sterile gloves, they are no longer sterile and you have to start over. So be careful with what you're doing. Grab the bottom of the cuff, stepping back so that you're not on top of your field. I will carefully put my gloves on. And for the second hand, grab underneath the cuff and fly that thumb away. All right. Remember, your table is at belly button height. You are keeping your elbows to your side so that you're never reaching over your sterile field. I have my patient at about belly height as well, so they are part of my sterile field and they need to be elevated as well. At this point, I can straighten this out. I am not going to use the fenestrated drape because I have a female and it really just gets in the way. Now I will set up my field. Open my swab sticks. Loosen them up and pull them out a little bit so that they're easy to access. We'll take my catheter out of the blue wrapping. Being careful to keep it in the box. You can open your lubricating jelly and stick that catheter right in there so it's ready for you. And then I will attach my syringe. Firmly. All right. Once that is ready, I'm going to go ahead and move it over to my patient. And remember that you want the syringe facing your patient so that it's easier to get it out. So I can go ahead and just move this right here. All right. Now I will use my left hand to spread my patient's labia so that I can clean effectively. All right. And you really need to open it to make sure that you can see where you're going. So we're gonna go straight down and throw that away. And go on the side farthest to us and throw that away. And then straight down. And I'm making sure not to go back over my field when I'm throwing these dirty swabs away. I'm pulling them to myself and throwing them in there. Get rid of that. All right, we're going to have your patient take a deep breath and insert the catheter. Breathe slowly. You're inserting until you see urine, and then another 1 to 2 inches. Okay, once you have it in there, move your left hand to hold the catheter in place and slowly inflate the balloon. And then you can gently tug to make sure it's seated in the bladder. We will clean up, attach our leg strap, get our patient comfortable, lower the bed, wash our hands, and document. Making sure you're documenting the size of the catheter, how your patient tolerated the procedure, any urine that came out, including the color, the consistency, if there was any odor, or if there's anything in it.